Hello and welcome back. I'm Dr. Ankit Gupta and today we are making a video on axillary breast, and this is the patient we'll be discussing with you. This is a 32-year-old lady and she presented to us with this swellings in her armpits, and this is called as axillary breasts. And if you have something similar and if you are looking to get a treatment for axillary breast, this video is for you.
Hello doctor, how do we differentiate between axillary breast and fat or weight gain?
So axillary breast is a swelling in your armpit which usually develops when you attain puberty. So it is nothing but an accessory or an extra breast that develops in your armpits. This can either develop during puberty or later on when you get pregnant and you start feeding your baby, and whenever the size of your breast increases, usually there's an increase in the swelling in your armpit, and that is usually the axillary breast. If in case it is a very smooth swelling which is very soft, there is no hard lump, does not change with your periods, there is never any pain, then it could be a fatty swelling or it could be something else. But yes, the definitive way to find out what it is through an ultrasound. An ultrasound can definitely tell you if it is an axillary breast swelling or is it an extra fat or something. But yeah, if you see a doctor, ideally a plastic surgeon, he should be able to diagnose it very easily. But in patients who have an extra skin, loose skin, something similar to what you see in this picture, then usually it is an axillary breast and not the fat.
So doctor, what is the best age or phase in life when you should get this treated?
So in case you have it since the puberty, you can get it operated before you get pregnant or before you start feeding your baby, because at that time the breast or the axillary breast is not very large, and you don't have a lot of extra skin in that area. In such cases, we can do a simple liposuction through a very teeny tiny hole, and through that we can take out or suck out all the extra fat and the gland, and it usually heals with a very small scar. So the scar is almost imperceptible and the cut that we need to give is very small. But once you become pregnant or once you have started feeding your baby, we cannot operate on you at least for 6 months after you have stopped feeding your baby. So after you have stopped feeding your baby, 6 months later we can do your surgery. What happens is, once you lactate your baby or you start feeding, the size of this becomes much bigger, and that is why the amount of skin increases in your armpit area. And once this happens, we need to excise the skin also. Only a liposuction won't suffice. So when you have a very small axillary breast, that is the best time to get it done. But yeah, if you have missed that train and if you have a very large axillary breast, get it operated as soon as you can.
Doctor, can you tell us something about this patient? Like, what is her age? When did she start having this problem?
So this patient is a 32-year young patient, and she had this problem since her puberty, and she was about to get married, and she never had kids or anything. It was during her puberty that she developed these axillary breasts, and it hampered her wearing shorts, these sleeveless dresses, and that is why she wanted to get rid of them.
So she is not overweight or anything. So can this problem occur in thin patients as well?
Yes, this is an extra breast. It has nothing to do with what your weight is. It's an extra breast that has developed in your armpit area. So there's a milk ridge that usually forms, which is from your armpit to your pubic area, and usually only a single breast develops on each milk ridge. But sometimes in few individuals, there are multiple areas where these breasts can develop, and this has nothing to do with your weight or your lifestyle or anything. It is a congenital or a birth problem that can happen to anybody.
Doctor, can you describe what procedure you have done for her? I mean, is it plain liposuction or was there any gland removal and skin excision involved?
So in this lady, we could have gone with only liposuction, but she wanted to make sure that this never happens again. So she wanted her gland to be completely gone. So what we did for her was initially a VASER liposuction. VASER is a technology which is an ultrasonic energy which can break down fat into liquid form. It also helps us to separate out all the fat from the gland, which makes the gland really small. Once we did that through a very small hole in the armpit, whatever remained, that is whatever gland remained and whatever loose skin was there, we excised that skin. These are the pictures of the skin and the gland that we took out. She did not want any hanging skin and wanted it to be completely removed, and she did not want it to reoccur during her pregnancies. So that is what we did for her. So we did a complete thing, that is we did a liposuction with VASER along with a power assisted liposuction along with skin removal, along with gland removal, and this is how she is in her before and after. If you can see, this is how her results are.
Will there be any scar after the procedure, doctor?
So if you are doing only a liposuction, it is done through a very teeny tiny hole. The scar is very small, which is usually in the armpit upper area. But if we are doing gland removal also, there is a scar which is approximately 3 to 4 inches long, depending on how much of a loose skin you have, and that usually is hidden in your armpit area. And this is the patient, as you can see, in which we have first done the liposuction and then taken out the skin as well. So this is the scar that you can see is very well hidden in the armpit area.
So doctor, do you have any final words of advice for any of our viewers who are interested in getting this procedure done?
Yeah, one thing I would like to make sure, would like to actually tell you that most of the queries that I get is during the lactating period or during pregnancy, because that is the time you develop these, and that is not the right age or the right time to get the surgery done. Ideally, you'll have to complete your pregnancy or lactation, whatever is being done, and after 6 months of lactation is the right time to get these surgeries done. And ideally you should get it done even before your pregnancy and all. In that way we can do it with a simple liposuction. We can do it under local anesthesia or general anesthesia, depending on if you are afraid of blood and some blood or something. But yeah, it's a very safe surgery, very simple surgery, and if you have this, you can easily approach us and we'll be happy to help you. Thank you and have a nice day.